Can you talk a little bit about how you got interested in emergency medicine? Because I know you're a registrar now in emergency medicine.
Yes, I am. Interestingly, when I finished medical school, I wanted to be so many different things. I wanted to do psychiatry. I had a scholarship because I did a bit of psychiatry research with the psychiatry department. Then I wanted to be a physician. I wanted to be everything because I loved so many different parts of medical specialties. But as I started my internship, I loved surgery. I think it was my best rotation. And my elder sister is actually a surgeon, and there is that elder sister, younger sister syndrome. So I wanted to be like her eventually. And a few months into my internship, one of my mentors now, an anesthesiologist who heads the anesthesia department, Dr. Tendo, told me, Annette, I think I know a perfect specialty for you. And I'm like, okay. And he says emergency medicine. And that's the first time I heard about emergency medicine. And I didn't know it, I didn't understand it. But he'd been exposed to it because he travels a lot and he's done a lot of training outside Uganda. And we spent an hour and he failed to convince me to do emergency medicine. But by the end of my internship, I think I agreed with him. I actually absolutely loved emergency care. I didn't know what the specialty is about. And it's taken me over 5 years to try to understand what it is. And the one thing I know is it's something that African countries really need, because a lot of our mortalities are from, acute complications of all types of diseases, from infectious to even non-communicable diseases are on the increase. And the sad thing is most of our emergency departments are staffed with the lowest level of health practitioners, the medical officers, the interns, who have absolutely no idea what to do with some of these cases. So we need people who are specialized in managing acute emergent conditions. And after many years, I'm glad that I'm in the program now, in training, and I look forward to finishing my training.
So can you tell us a bit about emergency medicine in your country, in Uganda? What is it like there?
Okay, first of all, there's no formal training. A lot of what we know about emergency medicine is what we read on the internet and what our mentors tell us, and what people we meet in wherever we go tell us about emergency medicine. And it's good the internet is there, because now the world is a small global village, so it's easy to information is easy to come by. But there's no formal training, although the process was already started, and it's supported by AFM, and we're really very grateful for that. They're supporting the establishment of an emergency physician's training. And hopefully these physicians can help train all the other different cadres of emergency care in the country. Apart from that, I already told you that emergency departments are staffed by very junior doctors and health practitioners. And actually 3 weeks ago, I was talking to one of we call her the godmother of trauma care in Uganda, Dr. Olive Kovusivye. And she was telling us that way back in 1998, the Ministry of Health actually established a policy across the country requiring all hospitals to have a resuscitation area and a public health department. I think that was really nice, but from 1998 till now, it doesn't exist. It exists somewhere, very nicely written on a paper, but it doesn't exist now because there is nobody to enforce these policies. And if we don't have people who are specifically trained to do this, then all our policies are going to exist on paper and patients will keep dying.
So how many specialists are in Uganda right now?
I don't know any. There isn't any.
You don't know any?
No, there isn't any. There isn't emergency physicians. We don't have a pre-hospital system. We don't have a proper spectrum of care. What the little emergency care we have is it's specific to different specialties. For example, the obstetricians promoting what is called emergency newborn and obstetric care at right from grassroots level, and then trying to do that. And then there's a bit of primary trauma care that is taught to certain cadres of health practitioners. And then there is integrated management of childhood childhood conditions, that's malaria, diarrhea, pneumonia for children. It's done by the pediatrician, the public health people. So there's a lot of different scattered aspects of emergency care that's going on, but it's not, there is no proper system. You cannot follow up some of these things. When something happens, it's very haphazard. So
I wanted to talk a little bit about the conference that you attended in November. It's called the African Conference on Emergency Medicine that was hosted by AFEM. Have you ever been to a conference before? And can you kind of talk a little bit about your experiences at the conference?
Okay, so that was really mind-blowing, the conference, I must admit. You know, when you're trying to achieve something, there's no system, there's barely anybody who understands what you're trying to do. A couple of people and I in Uganda are working to, drive the need for emergency care and emergency systems across the country. So it's very frustrating when, you're going into an area you don't fully understand, but you have the full, the enthusiasm and intent to get something that can help people in your country. And when you're in a room or in a place with people of like mind, it's unbelievable, the energy that's there. It's very positive. It's very motivating. There's a lot of drive that we got thereafter. When we went back home and we were like, okay, we have to do this. Did you see the Ethiopians? They have this. Oh, did you see the people in this country? In Egypt, they have this. Oh my God, in South Africa, they have this. No, we have to do this. It really gives you a drive that somebody who hasn't been in my situation probably wouldn't understand from struggling to getting something to actually push you really way forward. It's unbelievable. And also learning what people are doing in other countries, in Tanzania, and also networking. I have so many contacts now. If somebody asks me what's happening in Tanzania, I'm like, okay, hold. I can call up somebody and ask, do you people have this? It's unbelievable.
I know you went through the Supadel or Supadel program. Can you talk a little bit about it and what it is? And if you hadn't had support a delegate, if you would have been able to go to the conference?
No, I wouldn't. I definitely wouldn't have been able to go to the conference. Before the conference, a couple of friends and I were discussing, okay, if we go, let's look for YMCA, let's look for backpackers. It's very frustrating. Okay, no, that's ticket money, or it's really difficult. It's not so much money, but it's money that, so many people don't have. And to be given that opportunity to get that exposure was really great. I remember I'd actually given up about going to the conference. I had said, okay, I won't go, I'll hear about it, I'll read about it on the website. And I'd resigned myself to that. But I woke up one morning and checked my emails, and I got an email saying, oh, you've been selected for the program. And I was so excited. I called my friend and I said, Joseph, it was really exciting. And then I could plan. I'm like, okay, now I need to see what pre-conference. I want to learn about ECGs. I have to, ECG, ultrasound. It's difficult to actually explain that. It was very exciting. I'm really grateful for that opportunity.
So if there are any potential sponsors out there, what would you like to say to them? What is your message?
My message is support, and keep supporting. That's it, because it might seem small, $50, $100, $200. It might seem small to you, but what you're doing is contributing to a system that will have ripple effects. You support somebody who will get exposure, who will help a patient, who will improve, who will help the country, who will help the economy. It's boundless, really, the possibilities and the things that a small contribution can actually do.
Well, thank you for your time, and we wish you all the best.